everyone, welcome to Medical Iris. This is the channel which makes the study easy and interesting. So today's topic is the tuberculosis. We are going to learn in detail about the tuberculosis because one should know about this disease. It's important disease and one should aware of this disease, and also for the exam perspective, it's most often or the frequently asked question. So we are going to see the tuberculosis in the following manner or the content. First, we will see what is tuberculosis, pulmonary tuberculosis. It is a bacterial disease. We will see the morphology of the bacteria, the mode of transmission and the spread of the tuberculosis. There is a difference between the transmission and the spread of the infection. So we are going to see that also. Then the pathogenesis, clinical feature, diagnosis and the treatment. So first, by the definition, we will start that what is TB. So by the definition, TB is one of the bacterial disease, and it is caused due to the bacteria called as Mycobacterium tuberculosis. Whenever the person is having a chronic cough and the fever, it is clinically diagnosed as the TB, but final diagnosis is always based on the laboratory investigation. Now we are going to see in detail about the pulmonary tuberculosis. This bacteria, that is a Mycobacterium tuberculosis, when it affects the lungs, then it is called as the pulmonary tuberculosis. Now it like the word pulmonary refers to the lungs. It affects the tissues and the cells of the lungs. After that, we will see the morphology of the bacteria, means how the bacteria is look, the size, shape, its classification and the staining of the bacteria. So this bacteria is of the rod shape. It's the if we see the size, it's of the 3 micrometer in length and 0.3 micrometer in the width. Then this bacteria is of the rod shaped bacteria. It comes under the classification of the bacilli and it is stained by the acid fast. Therefore this bacteria is the acid fast bacteria. After that, we will see the transmission and the spread of the infection. Now, as I have mentioned that there is a difference between the transmission and the spread of the infection. The word transmission means when the infection is get transmitted from one person to the another person, it is called as the transmission of the infection. Now, what is spread? Spread, once the infected person, inside the body of the infected person, the bacteria, there is a spread of the disease from the one organ to the another organ. So this is what called as the spread of the infection. In short, the transmission of the infection from the person to the person and the spread of the infection is from the organ to organ. Okay, so we will see here the how this transmission of the bacilli get transmitted from the person to person. We will see it's transmitted by the 3 main route. The first one is the inhalation. Inhalation means by the route of the airway. Second one is the ingestion. Ingestion means by the route of mouth. Like person will eat the contaminated food and the water. After that, the inoculation. Inoculation means there is a direct contact with the bacilli by means of tissues and the mucous membrane. After that, we will see the pathogenesis of the tuberculosis. The word pathogenesis means how the disease occurs inside the body. So as we are seeing the pulmonary tuberculosis in detail, we will see the pathogenesis of the pulmonary tuberculosis in the detail. Okay, so by the definition, we will see the lungs is the main organ. The lungs is the main organ that affect in the tuberculosis, also the extrapulmonary site. Previously I have mentioned that the word pulmonary refers to the lungs. So pulmonary, that is the lung, is the main organ that affects in the tuberculosis, also the extrapulmonary site. Now this extrapulmonary site means the lymph node. It involves the lymph node. So this the tuberculosis having a 2 type of pathogenesis, the primary tuberculosis and the secondary tuberculosis. So this classification or this type depends upon the following 3 factors. What are the following 3 factors? The first one is the age. The age is related to the immunity. Whenever the person is healthy, this infection remains the latent, but whenever the immunity goes down, there is a chances of reinfection. Second one is the tissue response. Tissue response means how the body of a person reacts when the bacteria get entered inside the body. Third one is the infection with the bacilli. Which type of the bacilli is get infected? So this Mycobacterium tuberculosis when infect the persons, so depending on that the types are classified. Okay, so we will see first the primary tuberculosis. By the definition, first we will go the infection of an individual who has not been previously infected or the immunized. This means that the person is having infection for the first time in his life. It's called as a primary tuberculosis. Now, this primary tuberculosis is mainly we can say that there is a mainly depend upon the ghon complex. Whenever there is a presence of ghon complex, it says that there is a primary tuberculosis. No doubt this ghon complex is also present in the secondary tuberculosis, but in the primary tuberculosis there is a specific location is given. So this location is this is what the lungs is seen in the uh, inside the body, and the bacteria which enter through the route of the ingestion, inhalation, and the by the inoculation. So this mainly affect this site, that is the upper part of the lower lobe. This is the lower lobe, and this is the lower lobe and the upper part of the lower lobe. When the ghon focus is present inside at the upper part of the lower lobe, then it is called as the primary tuberculosis. Now the question comes, what is ghon complex, or what is ghon focus? So this ghon focus or the ghon complex is nothing but the lesion that is produced inside the lungs, and it involves the hilar lymph node, because the lungs is having a lymph node called as the hilar lymph node. So it involves the hilar lymph node. Sometimes it also involves the cervical group of the lymph node. After that, we will see the components of the ghon focus, what all includes in the ghon focus. So the component of the ghon focus is the pulmonary component, lymphatic vessel component, and the lymph node component. So the pulmonary component, it includes as I have said, this ghon complex is nothing but the lesion. So this lesion is of 1 to 2 centimeter area, 1 to 2 centimeter area of lesion, that the tubercle present in the pleura, and the most often on the upper part of the lower lobe it is present. So this is what the pulmonary component. Now second one is the lymphatic vessels. Lymphatic vessels, the vessels which contains the lymph. So it involves mainly the hilar lymph node, and during the draining of the lymph node there is a presence of macrophages and the bacilli, so through which the infection is get transmitted from the one organ to the another organ. So this is what the lymphatic vessels. Now third one is the lymph node. Lymph node, as I have said, that the lung is having the hilar lymph node, so it involves the hilar lymph node. There is enlargement of the lymph node. Along with that, it also involves the tracheobronchial lymph node. The next video we will see about the secondary tuberculosis, its clinical feature, diagnosis, and treatment. Thank you.